Good afternoon. If you can hear my voice, clap once. If you can hear my voice, clap twice. If you're still talking, thank you. Just kidding. It is so great to see that so many of you all have stayed throughout the conference. I was just talking with my colleagues about how usually at a conference you see the attrition and the rate of folks leaving, and it's so great to see you all still here. And I feel like, as our inaugural event, we're really building a community and building a family in this space and in this work, and really focusing on looking at the root causes of violence and our strategies for how we address that here in Harris County. I think what is also important is that we not just think about the fact that this is our job or we've had lived experience in this space, but I have a mug that says, it shouldn't have to happen to you for it to matter to you. Did y'all hear that? It shouldn't have to happen to you for it to matter to you. And that is really, really, I think, our calling. That is our inertia. That should be foundational to all of the work that we do, not just the day in and day out transactions of trying to elevate and lift people out of the cycle of violence, but how does each one of us reach somebody else that has nothing to do with this work? Nothing to do with this work to help us advance and move the needle. Because it comes down to all of us. And it really shouldn't have to happen to somebody for it to matter to them. So I'm excited to introduce our closing speaker for today. And we saved him to close because he is so powerful, so electric. The energy, his wisdom, his genius has been so important and inspirational to our teams and to me in terms of the work that we're doing. And we could not be here today without the work and expertise of Dr. Chico Tillman. So let me first just talk a little bit about him off the paper, because I was told I have to talk about him from this script right here. He didn't say it, but my team. Okay. So Dr. Chico Tillman is a senior research fellow at the University of Chicago Crime and Education Labs and a violence prevention advocate. He also serves on the leadership team of the Peace Consortium, the collaborative that runs Fund Peace. Dr. Tillman is one of the most renowned and accomplished violence prevention experts in the country, and his background illustrates decades of important advocacy and impact in the communities he served in. Formerly incarcerated, Dr. Tillman came home with the purpose of trying to change his community in a positive way. But he also made it a mission to make lasting and meaningful change in the communities he's worked with. Today, Dr. Tillman has over a decade in violence prevention, mental health, and reentry advocacy. He works with youth, young adults, and direct service providers in marginalized areas to help them hone their professional skills and improve their work performance. He is the former executive director of the YMCA of Metro Chicago's Youth Safety and Violence Prevention programs. Over the years, Dr. Tillman has continued to provide training and technical assistance to providers of violence prevention groups. In 2021, Dr. Tillman was recognized by President Biden for his national violence prevention work and invited to the White House. He is also the recipient of the 2018 Congressional Veterans Brain Trust Award and 2017 Ford Men of Courage Award for his work in Chicago's most vulnerable communities. He was also named the Practitioner of the Year in 2016 by the University of Illinois at Chicago Criminology Law and Justice Department. Dr. Tillman has played a crucial role in developing our community health and violence prevention services programs here at Harris County Public Health. We're proud to call Dr. Tillman a partner, a family member of Harris County Public Health, and he has been so instrumental in uniting us around our vision for how to interrupt violence here in Harris County. I cannot say enough about you, Dr. Tillman. You have been such an incredible partner, colleague, and I love the way that you lift other members of the community up, and you're willing to put us on your shoulders or on your back and drag us along with you in this important, incredible work. Thank you so much for your leadership, and without further ado, please join me in a round of applause for Dr. Tillman.
First of all, I stand before you as someone who is humbled, grateful, and appreciative of this opportunity to just be a co-laborer with you of this work. So many people talked about different ways we do this work today, and we heard many statistics. But in many cases, what they did is almost devalue that we're talking about human beings. Human beings that look like many of us, that are dying, that we know, that we work with, that we talk to, that we're friends with, and in many cases that are our family members. So I want to start this conversation by recognizing you, my superheroes, the people who allow me to wake up every day, the people who do this work unarmed, the people who get up whether they're sick, whether they're tired, whether they're not feeling it today, the people who get calls in the middle of the night, the people who work when they're laid off or work when hours aren't attributed to them. Give yourself a round of applause for the great work you do. The only reason I have this opportunity to do this work is because of my predecessors, people like Benny Lee, Dr. Troy, Miss Vanessa, people from all over the country, that Brother Marcus, that paved the way so individuals who have been deemed a curse to society could have a pathway to integrate back in. Now, I know I'm up here to talk about programs, so I'm going to matriculate into that conversation by saying, in America, check this out, 470,000 people die a year from homicides. Wrap your mind around 470,000 people getting shot. And that's globally, I mean. In America, it's 21,500. And in Texas, it's 1,400. And here in Houston, it's one a day, a little bit over one a day, 477 people dying. I know earlier I asked a question when one of the gentlemen was up here. And the reason I asked the question is because of the 21,000 people shot or are victims of homicides, 80% of them are black men. Now I heard everything everybody said. Black men are dying at an alarming rate, not from suicide, but from homicide. And when a homicide takes place, let's just be real. If a homicide happened next door, even though you're not directly impacted, you're indirectly impacted and you suffer from vicarious trauma. And you might not even know it. Because now, instead of going this way to work, you say, you know what, I'm going to start going this way. Or if you got children, now you change your routine of how they go to school because you know what, they be shooting down there. And the sad part is, in our communities, it happened over and over and over again. One of the young ladies said something today that really resonated with me. What's interesting is research didn't start around violence prevention, or it was around 25 million. Really, to this administration. In the Obama administration, they allowed us to get 25 million just to research. No money was allotted. But prior to that, in the 90s, in many cities like Chicago, New York, LA, over 1,000 people were killed in the cities a day, but no response. We have to come together and collaboratively combat violence. That's the answer. Collaboratively. I'm going to go into what CVI is and what CVI does, community violence intervention. But the answer is all of us starting by taking a shared responsibility and a shared effort. Everybody. Somebody asked in the other room, what can somebody do who isn't an outreach worker or directly involved in the work? Talk to your brother or your son or your nephew who you know involved in violence. They coming right out of our house. I think the biggest joke is we pretend like we don't know why the violence is up. But people aren't coming from different neighborhoods causing problems, or different states or different cities. It's really based upon the law of proximity. Typically where you see violence at, with people that live close to each other. Let me give you an interesting fact that's in LA and Chicago, really associated with gangs. Did you know that sensationalism or society will have you believe that vice lords and GDs are the opposite, right? Right? Or Crips and Blood are the opposite, right? But why in Chicago is it rarely vice lords and GDs at odds? Or Crips and Blood, for that sake, in LA? Because of the law of proximity. Typically because of concentrated poverty, individuals are fighting people close to them for scraps. And what they've done, the government systemically or society systemically, has caused us to do that initially through the grant program. They allowed us to compete against each other, and that's why we weren't seeing the results we wanted to see. Because we go in saying, I got to do better than you, or I got to compete against you in order to get the funding for survival. So we're really going into this for survival instead of collaboration. And it creates what? An enmity between me and my brother. And then they give you $10 million to solve a $10 billion problem. And then they tell you what? If you don't solve it by yourself, I'm going to take that $10 million back and give it to the other people who I've been giving billions to because they're already established. That's why I admire you. Because many of you started the work with nothing. Many of you started the work because of a passion, because of a fire inside, or because of a cataclysmic event that you just couldn't shake. Whether it's being a child being murdered, as Lucy Macbeth talked about with her son Jordan, or a friend being murdered, or seeing violence persist day after day in your community. And the fire in you began to burn so hot that you had to do something about it. And that's why I love you and I love everything you do in this work. Because you do it because of the fire and not of the resources. We go to people and we say, you know what, give us some resources and we could solve the problem. But the resources we need to solve these problems have to match the systemic oppression we faced over centuries in order to get us to this situation or this place in society. We can't solve it with scraps. Let me say one more thing, and then I'm going to get deeper into the real message about programs that work. Do not fall prey to this adversarial context that it's us against the police. We ain't got no problem with no police. Our problem is with funding and trying to save lives. And you know who we with? I love anybody trying to save black and brown lives. Anybody trying to support the work we're doing. Our beef is not with them. Our beef is with them is when they come in and they use institutional violence against our people. But all we ask in those cases is for them to set the record straight. If somebody do something that's wrong, then say it's wrong. That's it. Many of the challenges between police and community exist because they don't acknowledge that something wrong has taken place. And if you think about all the injustice that happened over the last 24 months, it could have been resolved through a simple statement: that is wrong, that's not what we train, we don't condone that behavior. And that's what we're asking for. So many people say, what do we do? What is CVI? In its simplest form, CVI is community violence intervention, which is a complementary strategy to policing that should be a permanent part of the public safety and public health ecosystem and be an item line so that we don't have to utilize funding for survival, but utilize funding for innovation. We should be a permanent item line, just the same way as other first responders, because in essence, that's what we are. We first responders. We respond to situations before it escalates to the standard of crime, and we deal with them on those terms. We utilize relational tactics to de-escalate situations. Let me give you a prime example of when we could have been effective and changed a lot of things that happened in history. And I want people to think about this that's in the room that do this work. Had they really had CVI and CVI been present in Minneapolis, the George Floyd situation never happened, because we deal with those type of situations every day. We deal with individuals where misdemeanors or small situations or interactions where personal conflict is involved, and we de-escalate it. We professionalize and de-escalate them. It was over $20. But the power dynamics sometimes between police and their high exposure to trauma, they come into a particular situation stressed, at outbursts, giving directives, not want to hear what the other person has to say, and what? It spirals out of control. Well, when we come up on a space or we come up on an individual, we're asking questions, seeking to understand and seeing how we can resolve it peacefully. Peacefully. The reason why we're so effective in many communities, not only in Houston, but throughout the United States, because a parent knows if they call us, everybody goes home. Just think about that. Everybody goes home. A parent can call us and say, hey, Chico, my son upset. I think he's going to get his gun. Can you talk to him? She knows she can trust me to de-escalate her son, bring him back to baseline, and the result is going to be him returning home. Where if she calls some other people, we don't really know the outcome. Because the outcome, the first thing going to go out is what? We got an individual armed and dangerous. But because of our relationship, we're able to approach him even though he's armed. We can approach that individual even though he's armed, and in many cases get him to put the firearm up. That is critical in Houston. That's critical in Houston. Why? Because they have open and concealed. They have open carry. You need individuals that can talk to individuals that are armed and get them what? To put up their firearm. Let's look at this continuum of care that we offer in CVI. The foundation of it is street intervention. Street intervention is the credible message that go into the community, work with individuals at the highest risk, and get them a pathway to success. That's what street intervention is. They have a relationship in the community, they're respected, and they're able to talk to individuals who are at the highest risk, but also offer them pathways back into mainstream society. That's what street intervention is about. Meeting individuals prior to violence occurring, not being responsive. The only way we're going to see results is people doing it what? Prior to. And that's what we do. And we're hyper-focused, because if you think about violence, less than 1% throughout the United States, especially in Houston, in Chicago, and throughout the United States, are the drivers of violence. Did y'all know that? Less than 1%. Let me give you a great example. Everybody in here been in high school, right? Everybody been in high school? We're a little old. I hope everybody been there. In high school, check this out. If we wanted to stop somebody from smoking, right? Stop they smoking in the bathroom. We wanted to stop it. Who would be the best people to get to do it? It wouldn't be the teachers. The teachers don't got an idea who's smoking in the bathroom. We could hire students, and the students gonna go right to the smokers. Hey, I got this job. Don't smoke in my bathroom, whatever you, because they already know who the smokers is. They know who come in the bathroom and smoke. And it's the same thing with people in street intervention. They already know the individuals and got relationships with the individuals in the community who are the perpetrators of violence, but also the victims of violence, and can go directly to them and have a conversation. But you gotta have the right people that's credible. You gotta have people that can get into those spaces and have those conversations with them. The second thing we got is case management. Case management is critical. A lot of us talk about the birth of this work. The birth of this work actually started in the early 90s. Many people say it started in Boston with what they call the Boston Miracle, when it was this guy, he's at John Jay now, I'm not gonna say his name, came up with David Kennedy came up with this idea around how to resolve violence by using individuals with credibility, but the problem was he used a fear-based approach. His approach was partner with the police, you call people, and you tell them, hey, you better stop doing what you're doing or you're going to jail. The problem with that was, in many cases and in many times, it puts the person that's making that call in danger. Because when they tell that person you're going to go to jail, if you don't stop what you're doing and they actually go to jail, what you think that person thinking? That person done told on me. And they put that person and their whole family at risk. Then, after that, evolved what we call the cure violence model, which used tenets of the public health model. Cure violence in and of itself is not the public health approach to violence. It just used tenets of the public health approach. But what's missing from cure violence, and I worked for cure violence for about 8 years, that it didn't have a behavior modification mechanism in place. It just worked with people externally to mediate situations, but what it didn't have was now what you do with the individuals once they get in the program. We relied too much on maturation process that hopefully they'll age out, or that they'll get some sociogenic properties, meaning they'll get married, they'll get a job. So really we was by chance. Recently, in the last 5 to 10 years, we have been developing what we call CBT, or curriculums or behavior modification models. In many cases, in some cases, non-traditional behavior modification models. So we can be more intentional with case management once we get individuals into these programs. Now we have a strategy in order to help them what? Change the way they think about dealing with conflict. 87% of all violence is what? Interpersonal conflict. It's not gangs, it's not drugs. I know that's the cool thing to say for politicians, but what it is a person who is in a gang and lives by a particular cultural norm has a situation with another individual, and based upon his value system, this is how he responds to it. If you do this, my value system says I respond this way. That's what it is. It's not people just killing each other because you in this gang, I'm in that gang. No, we have a conflict. My value system says this is the natural response. So what CBT does allows us to, or CBI, either one. CBT is cognitive behavioral therapy. CBI is cognitive behavior intervention. One uses therapists, one uses paraprofessionals. What it allows us to do now is what? Have situational thinking and say, okay, Chico, you stand at the Hilton way over there. If you take the street, it's going to take you 1 hour and 10 minutes to get here. I remember I came here yesterday. I'm going to tell y'all something funny, right? I came here yesterday, So first I put the address on there. This is a crazy city. Y'all got 2 places with the same address. I went to the Fanning that's downtown, another direct. I was like, and it was like a factory or something. I was like, man, I know this ain't the place. So somebody was like, no, you got to put the same address and put stadium in it. So I was like, why would you have 2 places with the same address? And then I jumped on the E-way and came. But had I used my GPS and put the stadium in, it would have gave me what? A better way of resolving the problem. So know what? This the same way CBT works. Check this out. So when I got up today to come what? I put the stadium in because it worked. And I put the address with it and it brought me here. And that's what we do with CBT. It ain't about brainwashing. It's about empowering. It's about letting it make sense to them so they can share it with others. And let me tell you this. It's many models out there. Know what's the best model? All of them. We need everybody. It ain't no one model. And I don't promote that. I'm not going around, do this. No, we need all models. Because you know what? Everybody has genius in them. Everybody has ideas. Everybody has thought. Everybody's innovative. And it's going to keep changing and growing and getting better. And we want everybody to be involved. I'm about inclusivity. I'm about everybody coming to the table. Everybody bringing their work. Because you know what? Now we're going to have shared responsibility. And that's what we need. It's no way in hell people should be getting up here and talking about taking a dime away from people, and we dying every damn day. Excuse my language. How you gonna get up here and talk about, well, we might not be able to give you that much funding because more people dying? That's insane. Just think about it. It's like the house on fire, and I say, you know what? The fire getting worse. Let's send some of the firemen back. That's what they're saying. Let's take some of the firemen and send them back. No, let it keep burning. It's going. But the other person said, but it's going to catch on to the next house. I don't care. Let's send some of them back. Man, I get frustrated. I cry. It breaks my heart when I have conversations with people in power and they act like they don't understand our pain. That's real. See, I got family members that got shot. I got family members that still live in them communities. I still go to them communities. I still deal with, this is real to me. And it's real to you. And when people come up here and say they can't decide, or we gotta let you, we gotta compromise or minimize what we going through so that you can feel good, you don't know how I feel. And that's why I look at you as heroes, because you know what? Despite all that, you still get up every day. You put your clothes on, you get outside, and you get to it. And that's real. And the cold part is, in some cases, people don't have benefits. In some cases, people don't get the proper pay or equity in pay. In many cases, women are undermined and not valued. And women do have a space in this work. Because in many cases, even in my case, a woman raised me, a single parent mother. And if they can guide the life cycle of an individual, they damn sure can guide a community and a movement. Another part of this CVI continuum of care is transitional jobs. When you get this individual into a space, I'm walking you on a journey. The outreach work or the street intervention engage him. They access this hard to reach population. The case management help him change his way of thinking. The third step it's a transitional job. The reason why I use the word transitional job is I got to work with you first. I got to get you used to working. Because in many cases, and you know what? Some of these guys brilliant. Many of these guys work, but never in a formal setting. So I got to say, hey, I know you used to coming to work when you want to. I know you used to doing what you want to, but there's some rules to this. You know, so I got to break them into the rules to let them know what they need to be doing day after day. To kind of like, almost like in sports, get them that conditioning. And then we're supposed to lead to permanent employment. To me, one of the biggest scams in the world is job readiness. And if that's all you do, then it's a problem. Job readiness without job placement is bull. Because really you training people, and you know what? That's what hurt us a lot. I'm training you to be something, but I don't got no job for you. Then I tell you to go on the internet. You going on the internet, you got a felony or you got this background, ain't nobody gonna hire you. So the only person benefited from the job readiness, what? It's the person that's running the program. So it has to be job readiness coupled with job placement that leads to permanent employment. One thing I love about the county, and I've been pushing them, it also has to be an opportunity too for upward mobility. Because it's guys bright, it's guys with drive, it's guys want to do something, it's guys done changed their life, and women too. It got to be a chance for them to grow. It got to be a chance for them to see a future in it. For many of them, they have families. And for many of them, they're exposed to high doses of trauma. And you only can be exposed to so much trauma before you reach burnout. So there has to be ways to move what? Laterally and upwardly. To go into different jobs. To utilize that skill set that's been refined and developed so that they can use it in other spaces. We often talk about cultural humility, cultural sensitivity, cultural competency. But the people that understand it the most, we don't give them the ability to demonstrate it. They know it better than anybody because they use it every day to survive. So allow them to what? Transform your whole organization because they live it. They live it. Their lives depend on it. And lastly, I want to talk about one more part, which might be the most important part, and that's wraparound services. And the reason why I say wraparound services is so important in the continuum of care because it's so diverse. Wraparound services, many people use that word and say, well, and let me be clear. Ain't no one organization doing no wraparound services. You can't no one organization do wraparound service. I don't care who you is. You can't. You can't. Because check this out. Every individual that comes through that door has a specific need, and you don't know what it's going to be. One guy might be dealing with substance use disorder. One guy might have mental health problems. One guy just might need a place to stay. You know, and when you think about it, one person might need legal help. So to say, I got an organization that do everything, I say, oh my God. You hear people say that. We do all the wraparound stuff. Stop it. That's why, look, let me show you something. That's why I love Director Robinson, because she understands that you got to be tied to the larger ecosystem in order to get them services. The power that you have at the county is the county network and the county services. ID, job, healthcare benefits. You know, almost anything you want is at their disposal, and what they don't got, they partners with the city. Just think about it. You with a county or a city, there's so many services, and that's how we got to think about it. That the work we do is a part of a larger system, but the larger system got to support us and help us. The only way violence gonna go down is if everybody get on board. Period. You want it to really dissipate? What they did, people say, well, it went down in L.A. and it went down in New York. Yeah, it went from 1,100 in L.A. down to 300, and in New York it went from 1,400 down to 200. You want me to tell you what they did in New York? Who want to know? They invested $130 million and gave them access to the city and all the city services. Huh? Huh? I can't hear you, huh? That's how you get results. I'm going to tell you something too, right? And I know it's election season, and I might get in trouble. Look at where people spend their money. My mama told me that before. She said, if you really want to know a person and who they are, watch how they spend their money. People cannot keep giving us broken promises. You work too hard. You work too hard. You worth more than that. I'm dead serious. You worth more than that. What you're doing is courageous. I admire everything everybody does. I respect other people. But I think the people I work with every day and get to interact with are the coldest people on this planet. I'm telling you. And when I go somewhere, I always talk about them with the highest esteem, because they always make something out of nothing. They always turn water into wine. They always take a little and turn it into a lot. And when no one else is there, they there standing with them families. Check this out. Lucy Macbeth said something powerful when she talked about her son, Jordan, and him transitioning and her naming him Jordan because of the promised land. But each and every one of you give me promise each and every day. Because when I get tired, I cut on Facebook and I see my boy Motivation. I'm dead serious. Or I see somebody else, or I see somebody else doing the work. And you know what? And even though I'm dealing with my mess, because a lot of people think we don't go through nothing, it forces me to get up and continue to work. Or when I see a tragedy happen in our community, and I know it ain't going to get better without us. If you don't do nothing today, do me one favor. Take a minute and love on yourself. Because we only came this far because of you. And I thank you, I thank you, I thank you. I know I was on the soapbox, now I answer the technical question. I didn't act like it, but I do got a PhD and I could answer technical questions if y'all want to go into it being research-driven or evidence-based and all of that. But any questions?
Dr. Tillman, first of all, y'all give him another round of applause. I don't know if you felt the energy or felt the inspiration, but this is why we do the work. And so thank you so much, Dr. Tillman. We're going to take 3 questions from the audience. Are there any questions? All right.
I wanted to ask you, what does mapping look like to you when it concerns the integration of services? What would that ideal mapping look like to you?
Oh man, could I be nerdy for a minute? Typically when I work with cities, Ms. Barbie can attest to it, the first thing I do is go through a scientific process called a problem analysis. I want to do a problem analysis because I want to identify the characteristics of the city and what challenges they face. When I do a problem analysis, the first thing I do is look at the data over the last 5 to 6 years. So I look at the data to see how many homicides, where the homicides are happening, what communities. The second thing I do is I do something called asset mapping. I look at the communities now and see what services or assets are in place that could potentially mitigate these particular atrocities. The third thing I do is qualitative interviewing. So now I want the story, because sometimes there's some historical context around why this situation is happening. So I go around and do focus groups. I do qualitative interviewing, and I find out why it's happening. And then based upon me being able to identify where it's happening, how it's happening, who it's happening to, the age demographics, and why it's happening, then I work with the city or the county to co-create, because I don't have all the answers. I might understand the processes or the science, but you know the city. You know the characteristics of the city, so we co-create or co-build something based upon your knowledge of the city and my knowledge of the science to mitigate the existing challenges. But then we say, okay, these are the gaps. And based upon the gaps, we look at the gaps and then we integrate inside a larger ecosystem and connect to the city or the county assets to fill those gaps. Did that answer? Pardon?
That was probably one of the most organic and authentic answers I have heard in years. And I wanted to thank you for your bravery, your courage, and your investment. I appreciate you. Thank you.
Any other question? Another question for Dr. Tillman.
Y'all gonna make me drop the mic.
Come on up, please.
I too want to applaud you for your presentation. It was just real. And so my question is, what were your findings in Houston?
Houston has some of the same challenges that other large urban areas have, which are social determinants of health, disinvestment, poor investment in schoolings, but lack of access to social systems that really hurt communities. But what we can do, the thing I'm encouraged about in Houston is it's more spatial than other cities, than a city like Chicago or New York, where in Chicago and New York, it's concentrated. I mean, it might be in the Austin community, in one community, it's 80 to 90,000 people, whereas Houston is more spread out, and it gives us an opportunity to really get in there and deconstruct some of those challenges. And also some of the challenges that I observed in Houston didn't have a lot of historical context. It was more just interpersonal conflict, where in other cities where it persists, it's historical, where it's been going on for 50 years. And it's hard to combat that because it could easily spark back up. Another thing I'm encouraged about in Houston is they were able to select the right people for the job. And anytime you get the right people to do the work and you got the right leader, you can make it happen. One thing I want to say too, I've been doing this work consistently for 12 years. I've never went to a space or scene where a program started and we didn't see impact. It's impossible. And let me just give you something simple. This ain't no Houdini, this ain't no magic. If we right now walk 10 individuals in here who are high risk mean at the highest risk of a fatality or at the highest risk to be a perpetrator of violence, an individual that's involved in violence. Out of those 10, it might be 2 or 3 just ready to throw their hands up and say, I'm tired of this. But if ain't nobody offering them, if there's nobody offering them nothing, then ain't nothing gonna happen. So just opening up the doors and opening up a program and engaging them individuals relentlessly, you're gonna see a 30% decline, 20 to 30% decline with the proper funding. That's the thing. Now let me show you something. We can't engage them and have nothing to give them. We can't engage them and just smile and say, here I am. Here I am. What's up? Here I am. No, that's why you gotta be properly resourced. She gotta be properly resourced. I'm gonna tell you, now, me and Marcus went all over the country getting on these mayors, governors, telling them about themselves. Do not evaluate a program until you properly resource it. Don't do it. You can't tell me how you gonna put me on the baseball field we playing lead ball with the hard ball and don't give none of my players gloves and wonder why we ain't catching the ball. Come on. I'm serious. Properly resourced, you're gonna see a decline. You're gonna see a decline. Just the law of average says you're gonna see a decline. It's a lot of smart people in here. This ain't no flim flam. You're gonna see a decline just by offering it to people. Now the work comes in with the relentless engagement with the other 70%. You gotta show them why they should change, why this is viable. Because really, I'm an individual that was at the highest risk. I know. Really, the biggest thing I struggled with was the fear of, can I make it in this world? Because this is all I know. I know this will work, but will this work? And to what degree? Because I'm going to tell you some of the things that we do as a society that's so unattractive. We see an individual thriving in a particular way in subculture, and we offer them some remedial. Hey, stop what you're doing and get a job at McDonald's. Come on. That's what we do. Stop what you're doing and be a janitor. They looking at you like, you got to give us something. She got to be resourced with something to work with. She got to have county and city jobs and things that's attractive. I'm going to say this, right? One thing I love or know about is romance, right? If you want to woo somebody, you got to give them what? Something appealing. You take a person, just say you meet a young lady or you meet a man and you want to take them out, and you say, hey, man, let's go out. You're excited. You say, man, just say one of you young ladies, you say, this is a nice-looking guy. And he say, hey, let's go out. You say, man, what's the name? Ask me out. He pull up the Wendy's and pull in and say, give me a 4 for $4. I'm getting me and you one. I don't care how he look, his status, you lost everything he had going for him, you lost. And that's the same way with us with them guys. Don't send us out there with nothing to offer them. One more question.
Okay, hi, I'm Dr. Nicole Burr-Stevens. I'm the CEO and founder of Resuscitate Incorporated, where we are breaking the silence to break the cycles of child sexual abuse and its trauma. I appreciate you because you are very, just like she said, very authentic. You spoke the language where everybody can hear and understand. I've been in community a long time, and the challenges that I've seen is that the problem with gatekeepers. And there are resources. You talked about the grants. You broke that thing down. It was so clear. It did something for me. Because I've seen it happen to where you have the large ecosystems and you have the wrong gatekeepers making decisions on who they're going to allocate funds to. And usually those that are already doing the work and are being impactful and impacting community, they get overlooked. And those funds get transitioned to organizations that are just padding numbers so that they can continue
to get funds to say something is happening, but true change is not happening in our communities. So with you being one of the change agents in our society that's speaking truth to power, how do we collaborate, not just as organizations, but possibly as leaders at a table, so that we can all gain strategies and a point of accountability to those who are entrusted with grant funding and how that funding gets allocated?
Man, I love that question, and I got it. It's a couple strategies, right? The first strategy I would say is collaboration, and Marcus can attest to it. Our problem is we don't want to collaborate. I'm gonna keep it. I gotta keep it real. Not just in Chicago, not in LA. Everywhere we went, we told them, listen, we finna ask for $100 million from this governor. Me and Marcus finna walk in here and snap on these people. Well, this person can't be at the table, or this person can't. I say, no, let's get the money first, and then we'll figure that. I'm telling you. So just by combining all the organizations under one umbrella, it gives you, it makes the budget look different. It makes the breadth look different. It makes your reach look, it changes the whole ask, and then it takes the political pressure off of the individual that is the gatekeeper. Another thing, don't get mad at me. You gotta get trained. I don't give all that everybody say they do it. You can do the work if you've never been trained, but we don't know if it's working or not, and people could be coming from the hip. If we got an organization and ain't nobody been trained, I don't know what nobody's doing. We ain't got no standard operating procedure. Everybody loosey-goosey. We can't do that. We gotta find a way to say, you know, even if you created yourself, I'm not saying you gotta go through this institution. You gotta be trained. You gotta have a 501c3. We gotta do the things that's necessary in order to get funding. If you don't get it, you gotta partner with a fiduciary. Cause I don't care how much work you're doing, they're not gonna give you no $2 million if all your budget been was what, $2,500 for the year, and you've been paying for everything out your pocket. They ain't gonna trust you with no $2 million. So you gotta work collaboratively, but also you gotta, it's some people in this work that you can trust, and you gotta get a fiscal agent to get you started. But while you got the fiscal agent, then you build up your reputation so you can do it on your own. Those are the key steps, either through collaboration or a fiscal agent. And Barbie, give me that sign. Your boy out of here.
Thank you so much. Thank you. So, again, thank you all for coming. And I know you're wondering, what are our next steps? You telling me to go up there? All right. Go ahead and turn this one off. So I know the question is, where do we go from here? Up, over, out, every direction, down, right? We heard from Dr. Tillman, we have to reach people where they are. And I just wanted to share a couple of programs or milestones for our work. Lupe Washington and our Community Health and Violence Prevention Services Division has done an incredible job of standing up two really critical and important pilot programs here in Harris County to address violence, to create alternative responder models. So I actually want to just stop in this moment and ask Ms. Washington and her team to stand up and give them a round of applause. They have done some incredible work. Just to share some statistics, our Holistic Assistance Response Team is a pilot program where we send alternative responders, non-law enforcement providers in the community to respond to crises in the community. The pilot program started in March with a goal of 750 calls. As of yesterday, they've already responded to 700 calls. That is incredible work, especially in government, which, you know, government years, right? We say we'll stand something up in 18 months, it's like 3 years later. So that is an incredible feat for her and her team. In terms of our community violence interruption program, we've disrupted 4 incidents of violence in our community. And based on the Everytown data, in terms of what a homicide costs, $200,000, $250,000, if you quantify that, we've already seen an incredible return on investment from our community violence interruption program, and that is incredible. So if folks are saying that it doesn't work, it works. We have to put in the work. We have to make the investments. And so I'm so proud of the efforts that Lupe and her team have done. Keep up the good fight. It is so critical. And as Dr. Tillman was talking about, it is not enough to interrupt the violence. It's not enough to build a relationship. Those are critical cornerstones to the work that we're doing, but you have to have the resources. And so we're joined today, I don't know if she's left already. Jamie Hughes is our director of our Access Initiative. Jamie, are you still here? She's gone. Access stands for Accessing Coordinated Care and Empowering Self-Sufficiency. And so the participants that are engaged in our violence prevention program are also going to be involved in Access. And what that involves is bringing the frontline staff across the community and government safety net system to wrap around those individuals. I'm amazed at the work that Access Sonoma County has done and Access in other parts of the country has done to wrap around vulnerable populations, and really not just to get them in the safety net, but get them out of it to improve well-being and self-sufficiency. So the next phase of our work is to wrap those services around individuals. I've been amazed at something as we would think is as simple as getting your ID, getting your birth certificate can set somebody on a trajectory and change their lives. And so I'm looking forward to all of the work. We have to have the portfolio of services and interventions that are available to help support individuals, and that's what the Access Initiative will bring to participants in the violence prevention programming we have. Now, I know that was a great question about community-based organizations and funding. Harris County Public Health will be standing up an initiative to address capacity building in our nonprofit organizations. It becomes a circular argument where there are community organizations or individuals with great intentions, goodwill, but they don't have the resources, the supports in order to develop their programming. And so we're going to be providing some grants to help community-based organizations build their capacity to contract with county government and other governmental entities to provide services. So please, please continue to stay watch, a hopeful eye as we bring a convening together of community-based organizations and then ultimately releasing RFP for that. So thank you all so much for attending. But before we close, I also want to just thank our incredible communications team. This conference would not have been possible without the hard work of Rohish Lau and his team. Rohish, please stand up. I know you don't want to, but this was a labor of love. It was our inaugural event. It was the first time that our department put on an event of this stature and this nature, and I'm so proud at the turnout, not just physically in the room, but also those who joined us online. I look forward to convening with you all again, not just in this conference forum, but in other micro forums where we can talk about the work that you're doing and make sure we're weaving and connecting it. As I said earlier, my favorite proverb, African proverb says, when spider webs unite, we can tie up a lion. And that is what we're hoping to do with tying up the line of violence and poverty, economic insecurity and inequities. Thank you so much for coming today. We really appreciate you all.